There has been great progress in the provision of medical care in the United States. It has been a great achievement, but it's been an achievement despite many of the best efforts of the American Medical Association, not because of it. This is a particularly appropriate place to illustrate my point, because the Mayo Clinic is a shining example of how medical care might have developed in the United States if it had not been for the power of organized medicine. That power was used effectively in the 1920s and the 1930s and later to hamper at every turn the kind of group practice that Mayo Clinic is so successful at. I venture to predict that if the brothers Mayo had tried to organize the clinic and its practice as they did in the 1920s or 30s, I doubt very much anything comparable to the Mayo Clinic could ever have developed or been achieved. Very few occasions have groups of physicians who wish to practice jointly, and particularly in a slightly different arrangement than Mayo's with prepaid care, they had enormous difficulty in getting established because of the concerted opposition of the American Medical Association. But whatever the reason, the effects are clear. In my opinion, if the American Medical Association had not exercised the monopoly power which it did over a long period of time, American medicine would have developed very differently than it in fact has. It would have developed, in my opinion, primarily through organizations such as the Mayo Clinic, through joint teams of hospitals and physicians, and I believe that that would have provided more adequate and more inexpensive and higher quality medical care to the American people.